gathered here today, as I said, to announce the launch of an initiative that has national and international public health relevance and ramifications. Antimicrobial resistance, or AMR, is considered amongst the most significant public health challenges of this century. AMR is a systemic resistance that bacteria and microbes develop over time as they are exposed to indiscriminate or excessive antibiotic use. And then they adapt and make sure that various antibiotics that are there in our armamentarium become ineffective, and our experts will dwell on that subject and give more insights. Over the past few years, AMR for diseases like tuberculosis has emerged as a critical health challenge for not just India, but for the entire world. And through this initiative, we hope to strengthen and build capacities to tackle AMR and contribute to the national mission against AMR. As we begin, and I request the first speaker to address us, I just request everybody to kindly put their mics on mute for the ease of other people's listening, and also for the ease of the address by our dignitaries. If there are questions, we will be taking them at the end of our dignitaries' address. But if there are questions that pop up, please do feel free to put them on the chat box, and we'll take them at the end of the session. We will now begin with the welcome address, and I request Dr. Rohini to kindly do the honor.
Thank you, Karan. Namaste, Chairman, sir, the leadership of the Apollo hospitals, my clinical colleagues from across the group, the nurses and the nursing leadership, clinical pharmacists, and all others who have participated already in this battle against antimicrobial resistance. Today, it is my privilege to be a part of the launch of the National Antimicrobial Stewardship Program. The German physiologist Paul Ehrlich, over 100 years ago, said that drug resistance follows the drug like a faithful shadow. And today we can see the reality of that in our day-to-day clinical practice. The statement that was made more than 100 years ago is perhaps never more true than today, when every hospital, however big or small, is facing this menace of antimicrobial resistance. Apollo Hospital has always been at the forefront of battling this menace, and over the years, several of my colleagues, clinical, nursing, clinical pharmacists, have in their own way tried to wage a battle against this menace. Today, however, we bring all these warriors on a single powerful tech-enabled platform to leverage the strength of the Apollo Group to do what we do so well: confer, collaborate, coordinate, and conquer. And that, I think, is what will happen once this AMSP program rolls out across the group. I'd like to extend my acknowledgement of the immense contributions made by Dr. Danya, Dr. Sujoy, the entire national advisory team, the infection control nurses across the group and the nursing leadership, the clinical pharmacists, but above all, my clinical colleagues who have stood with us in helping us to develop this program, and who will continue to support us as we take this program through to its logical conclusion. So I would also like to acknowledge the leadership, which starts with our chairman, who's always stood with us and pushed us to do what is best for the patient. And this will be a very important step of ensuring that we continue to deliver outstanding clinical outcomes, and all the excellent procedures, complex procedures that we do in our hospitals. The patient's recovery from these procedures is not stopped because they ran into a resistant bug. So with these few words, I'd like to again welcome everybody to the launch of this program and look forward to your contribution over the ensuing months to make sure that this program is a complete success. Thank you.
Thank you, Dr. Rohini. And as you mentioned, the dark shadow of AMR is clear and present. And to throw some more light on what it is and how it impacts health, we have a short AV for the benefit of people who have joined in today.
In 1928, when the world's first antibiotic that kills bacteria, penicillin, was discovered, it was hailed as a miracle drug, which saved countless lives and effectively treated various infectious diseases. Today, there are many natural and synthetic types of antibiotics available that have improved global health significantly. However, over the years, some of these microbes, bacteria, fungi, parasites, and viruses have become resistant to antimicrobial treatment, making infections more difficult and sometimes impossible to treat. Today, antimicrobial resistance has been identified among the top global public health crises faced by humanity. Irrational antibiotic use is main driver for AMR. It is estimated that by 2050 there will be 10 million deaths every year due to antimicrobial resistance, surpassing deaths due to other causes, including cancers. And there is very little progress in the antibiotic development pipeline. Antimicrobial Stewardship Program promotes appropriate use of antibiotics, reduces AMR, reduces the spread of drug-resistant infections, and improves patient outcomes. Committed to the rational use of antibiotics and improving patient outcomes, Apollo Hospitals initiated India's largest antimicrobial stewardship program covering 73 hospitals with an objective to optimize the use of antimicrobials. Apollo Hospitals' unique ASPR, improve awareness about AMR and the rational use of antibiotics. To reduce consumption of those restricted antibiotics which are to be used in multi-drug resistant infections. To enhance compliance to recommended antibiotic use to prevent surgical wound infections and for common infections. Strengthen the knowledge and evidence base through surveillance and research. This will be achieved by uniting ASP teams across all Apollo hospitals. All healthcare providers, including physicians, clinical pharmacists, nurses, and microbiologists at Apollo, will play a critical role in curbing the misuse or overuse of drugs with the support of the quality and IT team. Each one of us have to play an important role as good antimicrobial stewards, protecting patients from harm caused by the unnecessary use of antimicrobials and combating the rising antimicrobial resistance in our communities. Together, we can.
So as we can see, ladies and gentlemen, this is not a small issue. With 10 million deaths that what is being projected is a crisis of global standards. May I now request Dr. Anupam Sibul to give his remarks and highlight the importance of this program, please.
Namaste, Dr. Reddy, founder and chairman of Apollo Hospitals Group. Requesting everyone to please be on mute. I'll just wait for everyone to go on mute, please. So namaste everyone, Dr. Reddy, colleagues from across the Apollo Hospitals Group. We have members from our Apollo Stewardship Program that comprises of clinicians, nurses, pharmacologists, infection control experts, microbiologists, and we have hundreds of colleagues across all our 72 hospitals that have joined. Friends from the media, we know how busy you are, so really appreciate your joining us. And the core team that has put this program together, a very good morning to everyone. 1950s to 1960s were really important years. They were the golden period. That's where 50% of the antibiotics that we commonly use today were discovered. So imagine that happened like 50s to 60s. In fact, the last novel class of antibiotics was developed way back in 1984, daptomycin, and it took about 20 years to be licensed. So it's been more than 35 years since the last novel antibiotic class was discovered. So clearly there's been a discovery void. Now, if you look at data from 2021, there were only 27 new antibiotics in clinical development, but what is a matter of concern that only 6 out of these fulfill at least one of WHO's criteria for innovation: absence of known cross resistance, new target, new mode of action, and or new class. And only 2 of those are active against, out of these 6, against critical multi-drug resistance gram-negative bacterial pathogens that have very few treatment options. On the positive note, there are about 250 antimicrobial agents that are in early stage testing. This, of course, needs fast tracking. And what COVID has taught us is that if we work together, we break silos across countries, across sectors, then we can develop medication faster. And one would hope that some of these 250 reach later stages of testing and actually become available in the next few years. But again, it's going to be few years. So what do we do till then? Given the kind of challenges that we face, it's extremely important for us to focus on prevention. And that is why we are launching today the Apollo Antimicrobial Stewardship Program. This program has taken several months to develop. It has been a process which has required consultation across hospitals, across different experts with core knowledge in the space. It has entailed motivating teams, having very clear protocols, having a system where everyone can talk about what are the challenges they might face in their hospital locally, and what is it that we can do to overcome those challenges. It is digitally enabled, and we now have a system in place, an ecosystem in place to be able to launch what clearly is India's largest antimicrobial stewardship program. I'd like to thank everyone who've contributed to this, and a big thank you to our friends from the media for joining to be able to pass on this message that every time someone thinks about using an antibiotic, think twice. Think whether it's essential, think whether it's appropriate, think whether the dose is right, talk to your clinicians, ask questions. And of course, if you start an antibiotic for the right reason, it needs to be given for the right duration in the right dosage. So there are a lot of rights to get right. And I think the more awareness we create about antimicrobial resistance, antimicrobial stewardship, the stronger we will be in tackling this big challenge. Thank you very much, and over to you, Karan.
Thank you, Dr. Sibal. Once again, I just request everybody to kindly put your mics on mute. If there are any questions that our friends from the media have, kindly put them on the chat box or leave them for our Q&A session at the end of this event. May I now request Dr. Hari Prasad to address us all, sir.
Namaste, Chairman, sir. Leadership of the Apollo hospitals, doctors, nurses, pharmacists, and everybody involved in this program, media. To begin with, I would like to thank everybody for being here today for this important event. It is truly an important event because it has an impact across different areas of healthcare and beyond. In the early part of 19th century, infectious diseases contributed to the major burden in the world. Since the discovery of penicillin in 1928, antibiotics have significantly improved the situation, and gradually non-communicable diseases took over. However, decades of overuse and misuse of antibiotics have accelerated the emergence of spread of resistant bacteria. Today, drug resistance is top 10. Today, drug resistance is one of the top 10 global public health threats faced by humanity, and we can have a major impact on modern healthcare. Tuberculosis is a great example. We had reached a stage where the doctors could easily manage tuberculosis with the anti-tubercular drugs that were available. However, today, 4% of all newly diagnosed tuberculosis cases and 20% of those relapsed cases are resistant to regular anti-tubercular drugs. This is increasing the cost and duration of treatment, and the outcomes are not optimal. We are seeing deaths due to tuberculosis. Every effort must be made to avoid indiscriminate use of antibiotics and reduce the disease burden due to infectious diseases. Antibiotic stewardship is an important step in this direction, but not the only one. Regulatory support, awareness in the general population, and cross surveillance on use of antibiotics are equally important. Today, we are talking about this issue with an intention of highlighting the need of immediate, efficient, and effective measures to protect the current and future generations from infectious diseases. And much for being a part of this program, and request you all to take this up in a big way and spread the message across. Thank you, and over to you, Karan.
Thank you, sir. So as sir alluded to why this program is important, I think it's the right time to get Dr. Dhanya to basically explain the contours of the ASP program for the benefit of everybody who's joined in. Dr. Dhanya.
Thank you. Namaste, Chairman and the leadership, and good afternoon to everybody. Antimicrobial stewardship basically stimulates a rational thought process for finding answers to two very important questions during patient care. One, does my patient really require an antibiotic to recover from the illness? And two, if my patient requires an antibiotic, is it in the right antibiotic, in the right dose, in the right duration? Now, Apollo ASP specifically is a friendly program, though a structured program, and is based on the principles of handshake stewardship, where the clinician or the surgeon has the freedom to take the final call on the antibiotic. But at the same time, the program will serve as a robust support mechanism to improve the appropriate use of antibiotics. A detailed document of this program has been prepared through collective efforts and shared, and it outlines the individual roles and responsibilities, and everybody has a role to play as a good steward. As the famous quote goes, you can't improve it unless you measure it. So similarly for Apollo ASP, we shall be regularly auditing and analyzing the data with the help of IT support and to look for scopes of improvement. And this will be based on the internationally recommended ASP metrics. And most importantly, we shall continue to improve the awareness about antimicrobial resistance and the best evidence-based practices through training, education, and research. On behalf of my team, I take this opportunity to thank everybody who has been actively involved in this program, and I look forward for continued support from all. Thank you.
Thank you, Dr. Dhanya, for explaining to us the comprehensiveness and the evidence-backed nature, and also how we intend to track this and improve on this and launch this into the largest program of its sort in the country. Without further ado, I now request our chairman, sir, to kindly address us all. Sir. Sir, you're on mute. May I just request for sir's mic to be unmuted?
My greetings to the entire participants, especially to the media and the doctor fraternity. You know, we are now, this is another major initiative that Apollo has taken towards better health for all. You know, the antimicrobial resistance is becoming an increasing threat in the many healthcare problems that we are facing. You know, we are glorifying ourselves, saying that we today have made a significant advance in major surgical or medical management of patients. But we are having increasing threat from several things. One of the major threats that we are having, as the WHO has declared, one of the 10 major threats that healthcare today has is antimicrobial resistance. And with the antimicrobial resistance, we also must realize it's not just the bacteria, it is the parasites, it's the virus, it's the whole gamut of antimicrobial resistance, which has become an increasing threat. it's not because of the drugs. It is because of a lack of awareness and irrational use of drugs. This is where I think the initiative that Apollo has put together, Antimicrobial Stewardship program, will make a significant impact if the entire community, the people at large, and the doctors in particular, all follow the system saying, we will not treat unnecessarily before we have a rationale to use the right kind of drug. I think that is an important message that we would like to follow. Apollo has created an entire program to meet this huge challenge that the world is facing. And the WHO has emphasized this program. We've done many things, but many more things to do. The technology is going to make a very significant impact, but I think we should not forget that we have the people and the healthcare community must be aware that the huge threat from antimicrobial resistance is being faced, and it can be tackled, it should be tackled, and we will do it together. I think that is a significant step that by our launching this antimicrobial stewardship program by Apollo is another major step. I hope the world will cooperate with it. The entire community, healthcare people in particular, will follow this program and see that we remove another major rising problem in healthcare. God bless all of you. We need to work together. We've done many things working together, and I think learning from each other is another important thing. But now learning from what is good, what is necessary to use the right kind of antibiotics is another major step that we need to take. God bless all of you. Let's now take this as a challenge that we will together put in our efforts to follow this program, antimicrobial resistance, as a big threat, and face the problem and solve it. And we can, and we will. God bless all.
Thank you, sir. And thank you for lending your voice and highlighting this important issue. As you said, it requires teamwork, not just of the healthcare community, but the wider community as a whole, and how action needs to be taken as individuals, as the healthcare community, as policymakers. Everybody needs to get into this, because the challenge that this poses is for all sections of society and of the world. So thank you for your inspiring message. And with that, we draw close to the dignitaries' addresses that we have. At this moment, I'd request our colleagues who have joined us from across the Apollo network, given your busy schedules, please feel free to log out as we take the Q&As now from the media. As we wait for the questions to come in, I once again request our friends from the media to kindly put your questions on the chat box and to whom you'd address those questions to. And if you feel that you need to ask the question without typing it in, please just raise your hand and we'll come to you. And thank you all, the colleagues who have joined us from across the Apollo network. Please feel free to log off and continue with your busy schedules as always. Thank you once again. So I can already see a few questions that have been put on the chat box, and though some of them may not have the person that they'd like this question to be directed to, I'll just take the liberty of doing that. The first is from Arunima, and this one is for Dr. Sybil. So the question is, antibiotics are usually prescribed in primary health centers or at the secondary level, rather than in tertiary hospitals. How will the stewardship program address this challenge?
Thank you so much, Arunima. It's a very important question because antibiotics are used at all touch points: primary, secondary, tertiary, quaternary. Our program is going to also apply to our primary care network. As you perhaps might know, we have 300 primary care clinics We also have a network of clinics that we run in residential colonies. We also have a network of sugar clinics. So in all of these, wherever an antibiotic is prescribed, we will make sure that the same protocols that we have in terms of stewardship apply there. And we would hope that with our large ecosystem of more than 8,000 clinicians and 30,000 nurses, the message that they will take home will also pass on to the rest of the community, whether it's nursing, medical, pharmacists, everyone in healthcare, about being very judicious with the use of antibiotics. So it will encompass primary, secondary, tertiary, and quaternary care.
Thank you. If I could just ask you also a follow-up question on that, Dr. Sibul, what can individuals do to make sure that they contribute to this cause if you're not from the healthcare fraternity?
Well, I think that's again a very important question, Karan. The key point is that antibiotics are used left, right, and center. And quite often, antibiotics are used for viral infections. When they don't help, they're not needed, and they just help in development of resistance. So that's point number one. Do you actually need an antibiotic? So it's pretty much self-prescription should be out, and a prescription should only be given by a doctor who understands the need for the treatment of that condition. So second point is, quite often an antibiotic is started and then the dose is reduced by the individual who's having it on his or her own sort of decision, which should not happen. The third is the duration. It's very important to complete the duration for which it's prescribed. And sometimes there are some side effects. You might get diarrhea or you might get bloatedness and all. So that should be discussed with the clinician.
Right. Thank you for that. There is a question from Anand. How frequently MIC levels are planned to be done? Should we have a recommended antibiotic protocol to keep in place indiscriminate use?
I'm going to request Dania to answer the question on surgical prophylaxis, MIC, please.
So surgical prophylaxis, that's one major objective that we have to improve compliance. More than 90% is what we are targeting for next 6 months. So it will help prevent surgical wound infection. The question, how frequently MIC levels are planned to be done, our laboratories are equipped to give MIC levels on basis of which the clinicians and surgeons take a decision about choosing the antibiotics. So we are well equipped with that. Should we have a recommended antibiotic protocol in place? Yes, we have antibiotic formulary in place in every hospital. So this is also based on the local antibiotic resistance data. So that is already in place. Yes, thank you.
Dr. Dhanya, there is a question for you. For whom will this program primarily be addressed to? As in clinicians, or does it include nurses as well? The second question is, will case-by-case decision making come onto a common platform, or will there be a protocol in place?
So it will apply to everybody who is in the healthcare sector. In fact, our basic workforce is the infection control nurses and the clinical pharmacists who are very actively involved in this program. So everybody has a role to play. And the program will also, as I said, improve the awareness about resistance. And with time, there will be a thinking process set up for everybody regarding whether the antibiotic use is appropriate or not. Your second question, I'm sorry, can you repeat?
The second question is, will case-by-case decision-making come onto a common platform, or will there be a protocol in place?
So for now, it is extremely challenging to have every case discussed and appropriate antibiotic recommendation made. But this is, to start with, we are looking for gross issues in antibiotic prescription. And of course, as the capacity building improves, we would probably dwell into case-to-case analysis also. But that, as for the starting step, it will be looking at gross problems in antibiotic prescription.
Karan, if I might request Sujoy to answer, can I please request everyone to just check? I think a couple of colleagues have unmuted themselves and it's causing a disturbance. Everyone, can you please check whether you're muted or not? Thank you so much. The very important questions that have come in, that the culture report takes 72 hours. So how do you decide on the antibiotic when you choose it empirically? And there's some stellar work, some amazing work that has been done by Dr. Sujoy and his team. And Sujoy is a distinguished microbiologist. I'm going to request Sujoy to really comment on that and also talk about the empirical antibiotic protocols to avoid indiscriminate use. Sujoy.
Thank you, sir. Namaste, Chairman, sir. Of course, the work that we have been doing started 9 years back in Apollo system, when we actually consolidated the entire format of how we give our antibiotic sensitivity results from microbiology lab. And for the past 4 years, we have been monitoring from more than 30 plus of our hospitals, microbiology labs, collecting about more than 300,000 culture and sensitivity results to actually prepare a machine learning model which would actually predict what would be a good empirical antibiotic at a particular setting. And we are now field testing that, that particular part of the research and seeing how effective it is from the patient's outcome. The most important part in this is about how do we then use our background data, the insights that we get from our own data, to actually put it into practice and improve and reduce the burden of, giving antibiotics, high-end antibiotics to patients whenever they are coming into our ER or outpatient clinics or other centers.
Dr. Sujoy, I'd just also like to direct a question to you from Priya from HealthWire. And she's put it out there, your thoughts on antibiotic resistance. I think the question is, what is the prevalence? How big is the problem? Would you have any insights on that?
Well, yes, we do have, and we do have it from the community perspective. We published this in the Health of the Nation report last year as well, this year also and the previous year also. But what we're seeing is this, that we did see a little slump in the community-acquired infections, whether in terms of MRSA or ESBL, E. coli, Klebsiella, gram-negative organisms during 2020 or early days of 2021. However, we are seeing a resurgence in them where we are now moving on to pre-COVID era. In fact, in some cases, we are seeing there is a little bit of jump of around 2 to 3% in any one of these community-acquired resistance. And this is not a phenomenon in one part of the country. We are seeing this throughout the country.
Yeah, and that brings me to another question that we've got, and that is on, since, as you said, it differs from various parts of India, how can this problem be addressed? I think it's open to Dr. Sibyl, Dr. Dhania, and Dr.
I think Dhania might, because she studies this more than anyone else. Dhania.
The question was that how does it, I didn't get the question clearly.
So the question is that since there are differing problems around AMR in different parts of India, whether it's through prescription practice or others, how can this be addressed?
This requires a multi-pronged approach, because the problems, as you correctly mentioned, are complex. It right from the regulation of over-the-counter availability of antibiotics, and basically we need to improve the public awareness of antimicrobial resistance so that they don't resort to self-prescriptions and buying antibiotics without doctor's prescription. So all this boils down to multiple angles. One is we need a massive awareness campaign for the public to understand the gravity of the situation. Then, of course, the ongoing training of the healthcare staff about the AMR, and also support from the regulatory mechanisms, so regulatory authorities, so that irrational antibiotic combinations are not available, and various other things. And this just does not restrict to the health industry. It also, antibiotic resistance also is prevalent in other sectors, in food or agriculture. So all, basically, even this year's theme is about uniting all the sectors, not just the health sector, to combat this problem of AMR.
Also, Dhanya, there's one question that you might want to answer, which is that the resistant mechanisms are different in different parts of the country. At least the prevalence is different. So how are we going to address this as part of the Apollo ASP?
So one is, we have the advantage through Apollo that we are present in almost every corner of the country. So as we get the data, we would know the local prevalence of the resistance in that area. And and based on that, plus with Dr. Sujoy's wonderful work on that, can also help to identify the prevalence in that particular geographic area, to improve the antibiotic recommendations, which is customized to different places.
Right. Dr. Dhanya, thank you for that. One last chance for people to put their questions onto the chat box before we draw this to a close. And as we wait, Dr. Dhanya, I'd just like to ask you a question. Do we see that India is facing this crisis more than other parts of the world, or is the crisis pretty much uniform across the world?
The menace of antimicrobial resistance is all over the world. I mean, no one has been spared of that. But there are differences in the pattern of resistance. Like, for instance, in our parts, we see more of gram-negative bacterial resistance. And while in the Western countries, they do not see so much in gram-negative, but they see a lot more in gram-positive bacteria. So we do have differences, but the problem is there everywhere. And that is the reason why we probably need to have a unified, global effort for combating this problem.
Karan, if I might answer one question in terms of, the surgical prophylactic antibiotics sometimes are continued for a longer period. So how do you convince surgeons? A very important question that's been raised. It's basically about communication and monitoring. So when you have data and you measure it, then you can go back to colleagues and say, listen, perhaps, there was a slight deviation from the protocol, and perhaps we should understand why that happened, and that really helps. So when you start measuring, you start monitoring, things get better, and we already have a surveillance mechanism across all our hospitals. This data is collected for every surgery that we do. So with the robust mechanism in place, we believe that we will be able to convince colleagues with data, and I think that really works very well.
Right. So I've got two more questions as you were speaking. One is, what sort of measures would you take to strengthen hospital infection control measures, considering that there's a correlation between prescribing antibiotics and hospital infection rates? That's from Arunima.
So I can perhaps take a shot at that. So Arunima, basically, hospital infection control is a very broad topic. It starts with the hospital design. Frankly, we are fortunate that within the Apollo system, the hospitals have been designed in a fashion. The flows are very important. ICU, isolation, OT, sterilization. So it starts with that. The next very important component in terms of managing infection control is that at the governance level, at the top level, infection control is discussed, data is shared, and there are strategies in terms of strengthening hospital infection control. Then from an operational point of view, that you have teams that are dedicated to managing, preventing infections. And this includes a multidisciplinary approach that is collaborative. We have head of infection control, typically a microbiologist or someone who has a degree in infectious diseases. Includes pharmacy, includes nursing, includes clinicians, includes everyone that comes together and has a program in terms of hospital infection control. This program is reviewed every quarter. There is also an annual plan that is made, and that helps us in solidifying the whole approach towards hospital infection control. About Bhupendra's question, I think it will be really hard for us to comment, because the point that you're making is important, and it's about a national perspective that goes across public and private sector. And our focus, of course, is on our institution, which is the largest private network in the country. And we would hope that with the initiative that we are launching, this will start a movement where others will also talk within their system on how is it that they can strengthen the antimicrobial stewardship program.
Right. Thank you for answering Bhupendra's question as well. And since there are no more questions, we'll draw this discussion to a close. My thanks once again to our chairman, sir, for being here with us and to address us and to stay on to take these questions. Also to our dignitaries, Dr. Sibal, Dr. Rohini, Dr. Hari Prasad, Dr. Dhanya, thank you for enlightening us on this subject. And thanks once again to all my colleagues who've joined in big numbers. This is very reassuring, because we need every person to take this challenge head on in our day-to-day work and ensure that we can make a meaningful change to AMR levels in India. With that,
so Karan, sorry to interrupt, Karan. There's just one important thing that I wanted to raise. We also, to encourage this debate and how to take this across the length and breadth of the system, across from the leadership down to on the floor, we actually started a slogan competition in terms of what messaging should we have in terms of spreading the message. And this was competitive. It had to be like 6 words, and it had to be simple. So the winner is Dr. Aishwarya from the Apollo Proton Cancer Center. And the slogan she gave to us was, antibiotics, more we use, the more we lose. I think it's very powerful, very simple, very powerful. And the jury felt that this reflected the theme very well. More we use, more we lose. So I think that is something that we would urge everyone to think about. And our friends from media, if you can carry that. We also, Karan, Dr. Sangeeta has joined us. She was caught up in a meeting, and Dr. Sangeeta has been the motivational force behind this. Distinctly remember her conversation about, we have to do this. The country needs it. The world needs it. We have to do this. So really happy that we have Dr. Sangeeta for her closing remarks.
So, good afternoon, team. It is wonderful to see all of you. Healthcare advocates, we are today together speaking about one of the most important subjects in the ecosystem. It is critical for us because everything we do towards saving lives could get nullified if the environment or the ecosystem is vitiated because of inappropriate use of antibiotics. I request everyone to take this up as a campaign, to be extremely meticulous about building awareness, about sharing the thoughts, and being very, very careful. I love the slogan. The more you use, the more you lose. I think that's nothing could be more powerful than that. In a single line, we're conveying this message. We have created a very powerful AI-enabled system to message appropriate antibiotic usage. Dr. Sujoy and his team have put this together along with help from all the Apollo clinicians. We will be shortly launching that along with the clinical intelligence engine. So let all of us stay committed to this very powerful initiative that's going on. Congratulations, and to all of you, thank you, Anupam, and congrats everyone. Stay vigilant and take care. Thank you.
Thank you so much. Over to you, Karan.
Thank you, ma'am, for summing it up so well. With that, we'll draw this event to a close. Thank you once again, and please do your utmost to spread the message on AMR and what we all can do to contribute towards this menace. Thank you once again. Have a good day.